Well, good afternoon, everybody, and thank you for joining today's briefing on COVID-19 in North Carolina. Throughout this pandemic, we've worked to protect people's lives and livelihoods. In fact, North Carolina has ranked among the lowest states in COVID deaths and job loss per capita. In the early months when there was almost no PPE or testing and precious little vaccine or effective treatment, we put protections in place like mandatory masking and gathering limits that no doubt saved lives. And we got to work. We manufactured and stockpiled PPE, we expanded testing, and when effective treatments and miraculous vaccines became available, we pushed them out across the state. And all along, we informed the public about this virus, and we systematically reduced mandatory protections, relying more on people and businesses to make educated choices. These efforts have worked. We've prioritized getting children safely back in the classroom. We've made available an abundant amount of PPE and testing. And we've made safe, effective, and free vaccines available to everyone ages 5 and up. People continue to get vaccinated and boosted, and 75% of adults have had at least one shot in our state. We ended North Carolina's statewide mask mandate last spring, and we've relied on local school boards, local governments, and local public health officials to make good decisions. And for the most part, they have. I'm grateful for local officials who've done amazing work to protect children and save lives under difficult circumstances. In the last couple of months, the Omicron variant of this virus overran the nation quickly. Now, just about as fast as the numbers peaked, they're falling. This variant is clearly more contagious, yet generally causes less severe illness, particularly to people who are vaccinated and boosted. And now people know how to gauge their level of risk and decide how to best protect themselves. As a result of all these factors, I encourage schools and local governments to end their mask mandates. In a few minutes, our North Carolina Secretary of Health and Human Services, Cody Kinsley, will talk about the latest school guidance from health officials on masks, their recommended path to ending requirements, and the latest COVID data. People and businesses should continue to make the best decisions for themselves, their employees, and their customers. There are still some places, such as healthcare, long-term care, and public transportation, where a mask will still be required because of the setting or federal regulations. Learning how to live with this virus is a reality we all continue to face. Some people, including me, will feel more comfortable wearing a mask when they're in crowds, for example. Parents might still want their children wearing a mask inside school. Businesses might want their employees and customers to wear masks. At this stage of the pandemic, it's right for them to make these choices in most situations. But the most important thing people need to know is vaccines provide the strongest protection against serious illness, hospitalizations, and death from this virus. It is the unvaccinated who are experiencing the vast majority of COVID deaths. We've learned how to protect ourselves and each other from serious illness due to COVID. Now we take a positive step on mask requirements to help us move safely toward a more normal day-to-day life. And I know we all want that. Now I will recognize Cody Kinsley, our Secretary of the North Carolina Department of Health and Human Services, to share an update on our COVID data and our policy changes. Secretary Kinsley.
Thank you, Governor Cooper.